A few months ago, I did a video about the plague. Now, an even older biblical infection, tuberculosis, is in the news, with there being an outbreak in California. So let's talk about it. Hey everybody, it's Dr. David, a board certified pediatrician in Tampa, Florida. I'm someone who loves teaching people. That's why I keep this channel, to try to inform people, give them the most up-to-date information, accurate information, at least as accurate as I can provide. I'm also a geek when it comes to infectious diseases, and I'm just fascinated by different, not just the infectious disease itself, but how it interacts with the human body and how our body is able to deal with it, hopefully, the types of treatments, both natural as well as pharmaceutical, that may be helpful for dealing with infectious diseases. And of course, as many of you know, where I was when COVID was in the news every day, and how I even got to present to the FDA about the need for transparency as they move forward with their vaccine program. And unfortunately, that didn't really happen, but I did get to talk to the whole committee about that. So that was kind of neat that I got to do that. So anyways, today we're going to be talking about one of the oldest diseases known to mankind. This new outbreak that has happened in California. I'll tell you all the details about that, and also how concerned do we need to be. Now, tuberculosis itself, this is what we're talking about. It's actually caused by a bacteria called Mycobacterium tuberculosis. Okay. Now, this is an infection that dates back at least 9,000 years to humans. It actually was first based upon what the findings were in terms of locating this inside a human body. There's a city called Atlit Yam, which is a city now under the Mediterranean Sea. Back then, it was actually part of Israel, but as the waters have risen, it's now an underwater sea. But it was actually first located. They actually found bodies there. They were and they were able to identify it. I believe it was in a mother and daughter that they had found under the sea, and they found the bacteria there. So that was kind of interesting. At least I found it interesting. Now, worldwide, the infection itself is the 13th leading cause of death out of all causes across the world. 10.6 million people die from tuberculosis every year. 10.6 cases of tuberculosis every year. 1.3 million people die from tuberculosis worldwide every year. Now, in the United States, very different story. It is still here. There are about 8,000 cases per year in the United States, and there are about 600 deaths associated with the bacteria as well. Now, part of the challenge about tuberculosis is that the symptoms are all very non-specific. So there's not any one thing like a rash or a particular sound of a cough or a certain patterning that is seen that makes a medical provider suspect, oh, this is this disease or this is that disease. It's all non-specific. And so especially in America, where it's not common at all, it's not usually on the minds of most physicians, medical practitioners, as something that they would be diagnosing in somebody. But the symptoms there are mostly respiratory based. Okay. There's usually a bad cough that lasts for at least 3 weeks. There could be pain in the chest. But another thing is they can also be coughing up blood or sputum. If you have seen Moulin Rouge, that's what she had. They called the consumption back then, when she was bringing up the blood, but that's the same thing as well. And we know, well, I won't do any spoiler alerts there. Great movie, great play. If you haven't seen it yet, see it. But there are some other symptoms that, again, non-specific, that are not specifically to the respiratory tract, such as weakness or fatigue, weight loss, no appetite, chills, prolonged fever, and sweating at night. Okay, so now a little story from me back in my med school days. So this would have been around 1993 or so. I was in the emergency room at Medical College of Pennsylvania, and I had a woman who had come in with having some respiratory issues, but I was having a really difficult time, like, figuring out, based upon the history, she was just not a good history taker. Like, have you been having difficulty breathing? I don't know. So I said, okay, well, let me get some background information. I said, have you ever had asthma? And she says, no. I said, have you ever had an pneumonia? She said, no. Now, tuberculosis is also known as TB. And so I said, well, have you ever had TB? And she says, yes. I said, oh, you've had TB? She says, yeah, I got a TB up in my room. I watch it every night. I swear that's a true story. And I kind of at that point I'm like, okay, I'm not going to be getting anywhere. But we got to try to do the best we can. And now that I've been a provider for over 25 years, I probably could have asked some questions in the way I asked them for more functional manner than I do now. But that was as good as I could do back then. I walked out and said to the attending physician, "I got nothing here. I need some help here." So, anyways, that's my story. Okay. Now, as far as the tuberculosis, another issue is that it can be latent. You don't necessarily start off and have the symptoms right away. It could be in your system for years with no symptoms, and then something may happen to trigger it, immunodeficiency, or it's just when you're older, and it can trigger. So the infection could have been there for a long time. So just because someone is symptomatic doesn't necessarily mean that it's new, although usually it is. But there's a couple other interesting things, especially to people who listen to this channel. Vitamin D deficiency, vitamin A deficiency, and zinc deficiency are all associated with an increased risk for tuberculosis, for TB. And so, yes, we talk about our immune protocol, starting the vitamin A and the zinc. And of course, our protocol, as always, is found in the patient portal for our patients. But for anybody who wants access to that, we do have it available on our Patreon. So you can become a Patreon member and get all of that information there as well. But basically, the issue is that deficiency prior. Okay, so are you taking enough vitamin A? And again, this is not just for tuberculosis, because this is for all things. This was also found true for COVID. We've discovered this early on, why we think that our patients had such a different outcome overall, with so few people getting hospitalized and nobody dying from it, unlike what we hear everywhere else. So you want to have those vitamin D levels and the zinc levels checked to make sure that they're good. If you may have heard me, like when doing blood tests, I like to get them in the middle of range. I feel that's a good place to be at, not just barely scraping by. Vitamin A as well, but taking them on a regular basis, at least for vitamin A, the recommended daily allowance, because obviously know you're about to catch tuberculosis, so we want those to be good all of the time. Okay, now another thing about this bacteria, it's not overly contagious. You have to be around somebody for hours, maybe living with somebody for a period of time. It's not like COVID or some of the other viruses out there that you could be exposed for just a few minutes. One cough in your face could be enough. It's not that level of contagious. Okay, so why are we talking about this now? Okay, so in Long Beach, California, in this month, there was an outbreak, and they declared a public health emergency there. And the outbreak actually stemmed from a single room occupancy hotel that was in the city. For those who don't know, those are usually places that with people with lower income may stay at. Maybe they have their temporary housing, or maybe they're homeless and they're put up there. So yes, there is certainly a patient population with people who may have less means, which of course is a risk in of itself to tuberculosis, but it did happen here. So there were 14 people who have been identified so far with tuberculosis. 9 of them, of the 14, were hospitalized. So when you get it, if you do get this outbreak, it can get you pretty sick. And one of the 14 people died. So that's obviously 7%, if my math is correct, but obviously that is kind of the numbers that we've been seeing nationally. Now, it's also been estimated that 170 people were likely to be exposed because of this living situation. And all of those numbers, as I said here, they're all expected to rise as more cases come forth. Okay. Now, as I said, the population that's most at risk for tuberculosis are people who are homeless, who have housing insecurity in and out. They do find that as a whole, that people with mental illnesses, substance abuse, as well as people with serious medical comorbidities are also people more likely to get sick with tuberculosis. Now, what do you do? First of all, if you suspect that you've been exposed, or if the medical provider suspects, you got to test as soon as possible. And again, part of the issue is that really most of us, it's not something that's on the forefront of our mind. Okay, but there are 2 different types of tests. One is a skin test. There's a small injection that's done right under the skin. Usually it's done kind of like right here with a needle. It's not a shot in this way, but it's more of like a sideways, like right under the skin. And then you have to go back 2 to 3 days later where they read it, and you see if there's any swelling, and like how big that swelling is. And if it gets to a certain size, then it is considered positive for a person having tuberculosis. Now, there is also a blood test called an interferon gamma release assay. Most labs do have it now, and it does require a blood draw. It is also, if one is out of pocket, significantly more expensive than doing the skin test. Now, in terms of what kind of treatments are available itself, well, there is an antibiotic cocktail. There's 4 different antibiotics that need to be taken if a person has this. And there are some variances based upon, if they know it's in the community. But there is also antibiotic resistance that has developed to this, making some of those changes necessary. Now, there is a vaccine. It is not something that is given in United States. It is something that is more seen and used still in underdeveloped countries where there is much higher incidence of tuberculosis. Now, there may be a certain circumstance in the because maybe you're living with somebody who has it, or we know has latent infection, but you're immunocompromised. So there are a few exceptions as to giving the vaccine in America, but it's not. It's an incredibly rare thing that's done here. Now, what's my take overall? For most people in America, you're at very, very low risk of ever catching tuberculosis. In fact, in Florida, it used to be that we would have to do the skin test on people to go into school. Now you don't even. Now you ask questions such as, certain risk factors. And if a person hasn't traveled to an endemic area or doesn't have any of those lifestyle risk factors or around somebody who does, then actually you don't. Just the questionnaire is enough, and the provider just checks off that there's been a verbal screening. Okay, so but again, kind of as I said before, make sure that you have good vitamin D, zinc, and vitamin A levels. This is good for everything, for combating autoimmunity, for dealing with things like allergies and asthma and eczema. So, I know I sound like a broken record, but get on these things if you're not. Make sure you're getting your levels checked so that you know exactly what you need. Okay, and of course, you start the immune support protocol for any infection because, since this is non-specific, but even as we talked about with other things like measles and chickenpox, it starts off with a cold or flu-like illness and something develops later. So you always want to start that high-dose vitamin A along with the echinacea or arabinogalactan, along with the high-dose zinc and vitamin C, again, found on our Patreon, on our site, there for members there as well as for our patients. But I tell people the first sign of illness. If you ask yourself, should we start this? The answer is always yes. Start it. Okay. Now, of course, there's other information on our Patreon stuff there. A lot of my holistic protocols are found there, and of course, so besides that. If you like what you hear here, please share it with other people. Please hit the subscribe button. We really would love to be able to share with as many people as possible. Have a great day.